If you want to know how to prevent prostate enlargement, pay attention to this video because we will explain in detail and in a simple way for you to understand the best ways to prevent prostate enlargement. But what exactly is happening when the prostate enlarges, and why does it matter? Today we're diving into the risky world of prostate health to understand what benign prostatic hyperplasia, or BPH, really is. So let's start with the fundamentals. The prostate is a walnut-sized organ located just below the bladder, surrounding the urethra, which is the tube you urinate through. As men age, the prostate can start to grow. But why does this happen? Well, it all comes down to androgens, which are hormones like testosterone. In the prostate, testosterone converts into a more potent hormone called dihydrotestosterone, or DHT. This DHT binds to androgen receptors in the prostate and stimulates cell growth. Over time, this increased cell production leads to the enlargement of the prostate. But here's the kicker. While men's testosterone levels generally decline with age, DHT levels in the prostate remain high. This persistent presence of DHT is a major factor in the continued growth of the prostate, leading to BPH. Understanding this process is crucial because an enlarged prostate can cause significant urinary problems, affecting your quality of life. But don't worry, we're here to break it all down and help you navigate the best ways to prevent and manage prostate enlargement. Stay tuned, because in the next segments we'll explore the causes, prevention strategies, and effective treatments for BPH. You won't want to miss it. To know how to prevent prostate enlargement, it is important to understand the causes of BPH. So what exactly causes the prostate to enlarge? It turns out several factors can contribute to this condition. The first factor is genetics. If your father or grandfather had an enlarged prostate, chances are you might experience it too. BPH can be inherited, particularly if prostate issues appear before the age of 60. So, if you have a family history of BPH, it's something to keep an eye on. Next up is inflammation. This term gets thrown around a lot, but in this context, it refers to swelling and irritation within the prostate. Inflammation can be caused by bacterial or viral infections, hormonal changes, or even autoimmune conditions where the body attacks its own tissues. Another interesting cause of inflammation is urine refluxing back into the prostate ducts, which can create a lot of irritation. Is also considered a major influencing factor the hormonal changes. As men age, their hormonal balance can shift. While testosterone levels generally decline, other hormonal changes can still trigger prostate cell growth. This isn't just about having high levels of testosterone, it's about how these hormones interact with the prostate. Lastly, we have the imbalance between cell growth and cell death. Normally, cells in your body grow and die in a balanced manner. However, in the prostate, this balance can be disrupted, leading to more cells growing than dying. This imbalance is often influenced by growth factors like epidermal growth factor, insulin-like growth factor, and others. These growth factors can promote the proliferation of prostate cells, contributing to its enlargement. So to sum it up, genetic predisposition, inflammation, hormonal changes, and an imbalance in cell growth and death all play a role in causing BPH. So how to prevent prostate enlargement, or BPH? The good news is there are many proactive steps you can take to reduce your risk. First up, let's tackle metabolic syndrome. This is a cluster of conditions like diabetes, high cholesterol, and high blood pressure. These conditions are often interlinked and can significantly increase your risk of developing BPH. So, how do you avoid metabolic syndrome? It starts with a healthy lifestyle. Maintaining a healthy body mass index, or BMI, is crucial. Excess body weight, especially around the waist, is a significant risk factor for BPH. Studies have shown that a high BMI can more than double your risk. So aiming for a healthy weight through a balanced diet and regular exercise can make a big difference. Speaking of exercise, staying physically active is one of the most effective ways to prevent BPH. Research shows that even light physical activity can reduce your risk by about 30%. Activities like walking for just 20 minutes a day can have a substantial impact. If you can increase your activity to moderate or vigorous levels, the benefits are even greater. Regular exercise helps improve circulation, reduce inflammation, and maintain a healthy weight, all of which are beneficial for prostate health. Another critical aspect is diet. Avoiding high-fat foods, red meat, and simple carbohydrates can help lower your risk. Instead, focus on a diet rich in vegetables, fruits, whole grains, and lean proteins. The Mediterranean diet is a great example of a balanced, prostate-friendly eating plan. This diet emphasizes healthy fats, like those found in olive oil and fish, and plenty of plant-based foods. Lastly, be mindful of your overall health. Regular checkups with your healthcare provider can help monitor your blood pressure, cholesterol levels, and blood sugar. Early detection and management of these conditions can prevent them from escalating into metabolic syndrome and increasing your BPH risk. To recap, avoiding metabolic syndrome, maintaining a healthy BMI, staying physically active, and following a balanced diet are all powerful strategies to prevent prostate enlargement. Up next, we'll discuss the role of diet in more detail, including specific foods that can help keep your prostate healthy. There is one specific nutrient that has been the subject of many studies: lycopene. Lycopene is a powerful antioxidant found primarily in tomatoes. It has been shown to reduce inflammation and may help lower the risk of BPH. In some studies, men who consumed higher amounts of lycopene had a lower risk of developing prostate issues. However, the evidence is mixed, and not all studies agree. But since tomatoes and other lycopene-rich foods like watermelon and pink grapefruit are healthy options, including them in your diet is a good idea. Interestingly, lycopene may be more effective when tomatoes are cooked. Cooking tomatoes, like in tomato sauce or paste, makes lycopene more bioavailable, meaning your body can absorb and use it more efficiently. So, adding cooked tomato products to your meals could be particularly beneficial. To summarize, high-fat diets, high red meat consumption, and low vegetable intake can all increase your risk of BPH. Incorporating more vegetables and lycopene-rich foods into your diet, especially cooked tomatoes, may help reduce this risk. Another important topic that often gets overlooked: medication awareness. If you're dealing with or trying to prevent BPH, it's crucial to be mindful of certain medications that can exacerbate your symptoms. First on the list are antihistamines. These are commonly used to treat allergies and colds. While they can provide relief from sneezing and runny noses, antihistamines can also relax the bladder muscles. This relaxation makes it harder for the bladder to contract and push urine past an enlarged prostate, leading to urinary retention. If you have BPH, it's wise to use antihistamines cautiously and discuss alternatives with your healthcare provider. Next, we have decongestants. Medications like pseudoephedrine, found in many over-the-counter cold and flu remedies, can worsen BPH symptoms. Decongestants work by tightening blood vessels to reduce nasal congestion, but they also tighten the muscles around the bladder, neck, and prostate. This tightening can make it more difficult to urinate, aggravating BPH symptoms. If you're struggling with urinary issues, it's best to avoid decongestants or seek advice from your doctor for safer options. Antidepressants, particularly tricyclic antidepressants, can also impact BPH symptoms. These medications can interfere with bladder function, leading to urinary retention or difficulty urinating. If you're taking antidepressants and experiencing BPH symptoms, talk to your healthcare provider. There may be alternative treatments for your depression that won't affect your prostate health. Being aware of these medication effects is crucial. Always consult with your healthcare provider before starting or stopping any medication, especially if you have BPH. They can help you find the right balance between managing your health conditions and minimizing any negative impact on your prostate. In this channel, we explore lifestyle changes and natural remedies that can support prostate health and potentially reduce BPH symptoms. Keep watching to learn more. Here are some videos you may like to watch: the top 10 essential eating tips for prostate health, or our playlist full of interesting tips. Don't forget to subscribe to the channel and leave a like on this video to support our work in bringing you more quality content like this.